Jatend migawo mar thieth Susan Wafula wacho ni jochiw thieth mapacho ka gin mago manigi lony mamalo mimanyo nyaka e pinje maoko. Kane owuoyo e nyasi mar 91 mar sidho osimbo ne jopuonjre mag KMTC, Wafula wacho ni jopuonjre mawuok e kar tiegruok no tiyo gi yo manyasani mar thieth makonyo ting'o malo sekta mar thieth mapacho ka. Jopuonjre mar 15,915 ne osidhi ayanga e nyasi no.
You have shown commitment.
This far, the college has reviewed and developed a number of policies to address emerging issues in the health sector, as well as strengthen the performance of our mandate. We joined the Ministry of Health in flagging off the first batch of nurses to work in the United Kingdom as part of a bilateral agreement between Kenya and the UK government.
Our health workforce, and especially nurses, are now migrating to other countries, and the ministry is spearheading efforts to create more international jobs, opportunities for other cadres as well. KMTC thus has to be intentional in creating training opportunities responsive to both local and global markets. Ladies and gentlemen, the Ministry of Health is harmonizing and implementing several policy reforms and programs in health sector. This includes the universal health coverage and health insurance subsidy programs for the poor and vulnerable households. The revision of the UHC benefit package will allow Kenyans covered under NHIF to enjoy more services. As a matter of fact, the government is committed to increase the beneficiaries from 1 million to 5 million people by the end of 5 years.